Hola, muy buenos días, buenas tardes y bienvenidos a esta sesión informativa de la Organización Panamericana de la Salud sobre la pandemia de COVID-19 en las Américas. Hoy es el miércoles 3 de noviembre de 2021 y yo soy Luciana Viegas, asesora de Asuntos Públicos de la OPS. Hago hoy la moderación de la sesión que durará cerca de una hora. Como todas las semanas, contamos con interpretación simultánea al inglés, portugués y francés, y la opción se encuentra en el botón Interpretation. Ya hemos recibido preguntas por correo electrónico y, claro, podrán también hacer preguntas durante la sesión a través del botón Q&A. Les pido, por favor, para incluir su nombre y el medio que representan al enviarnos las preguntas. Hoy el doctor Jarbas Barbosa, subdirector de la OPS, les informará sobre la situación de COVID-19 en las Américas y también sobre nuestras recomendaciones para dosis de vacunas adicionales o de refuerzo, los boosters. Acompaña al doctor Barbosa en esta sesión de hoy el doctor Ciro Ugarte, director de emergencias en salud de la OPS, y el doctor Silván Aldiguieri, gerente de incidente para COVID-19 de la OPS. Ahora gustaría invitar al doctor Barbosa a compartir sus palabras de apertura y proporcionarnos la actualización regional. Doctor Barbosa, por favor.
Thank you, Luciana. Welcome and thank you for joining today's briefing. Over the last week, the region of the Americas reported more than 745,020 new cases, new COVID-19 infections, and just over 18,000 COVID-related deaths. This is the 8th consecutive week that overall cases have declined in the region. In North America, all 3 countries reported drops in weekly cases and deaths, and there has been a notable decline in hospitalizations in the United States and Canada. There have been similar declines across most countries in Central America. After weeks of a persistent outbreak in Belize, I am pleased to report a nearly 20% decrease in cases and a 60% decrease in deaths. The same downward trends are present in much of South America, save for a few exceptions that we are monitoring closely. In all countries, there are publishing data about the vaccination status of the hospitalized cases. A very high percentage of those hospitalized have not been immunized against the virus. Consistent with the other parts of the region, cases and deaths are trending downwards or remaining stable throughout much of the Caribbean. However, Barbados continues to report its highest number of COVID-related infections and deaths since the start of the pandemic, and there are concerning shortages of hospital capacity in the Dominican Republic and Trinidad and Tobago. The progress in our region is not a reason to become complacent or discontinue the public health measures that help keep us safe. Quite the opposite. The decline in cases and deaths shows that our approach is working, and it is critical for all of us to stay the course until everyone is vaccinated and protected from the virus. To date, 1.1 billion COVID vaccines doses have been administered across the Americas, and 46% of the population of Latin America and the Caribbean has been fully vaccinated. At least 32 countries have already reached the WHO's target of 40% vaccination coverage, and several more are on track to reach and surpass it by the end of this year. This progress is encouraging, but not surprising, thanks to our region's strong immunization systems. However, there are still several countries facing delays and 19 that remain below the 40% target. PAHO is working closely with all these countries, especially Haiti, Nicaragua, Jamaica, St. Vincent and the Grenadines, and Guatemala, which are still below 20% coverage. Vaccine ineptity remains the biggest barrier to reaching our coverage targets. The COVAX facility, with the support of PAHO's revolving fund, has delivered 64.3 million doses to the region. Roughly 30% of these vaccines, over 19 million doses, were donations by the United States, Spain, Canada, and other governments. We are thankful for these donations, which have improved the situation in the Americas. We continue to expect the allocation of vaccines from COVAX to accelerate in the coming weeks. So we urge countries to monitor their absorptive capacity and to continue to scale up vaccination operations. PAHO is providing technical cooperation to our member states in all relevant aspects to guarantee successful vaccination. Communication strategy, training healthcare workers, adopting new strategies to facilitate the access of the population and cold chain capacity. We are also supporting countries to overcome supply problems with syringes and diluents. That means we must make investment in immunization capacity and staffing a top priority. Our investments today will pave the way for a strong recovery after the pandemic. As more vaccines become available, countries need to make decisions about how to prioritize doses among their populations. These decisions are ultimately up to individual countries based on the vaccination coverage and the availability of vaccines they have, but should always be based on evidence, equity, and the commitment to protect our most vulnerable. So, I want to reinforce the latest guidance from the WHO Strategic Advisory Group of Experts on Immunization, SAGE, on a couple of key topics. The first is the bedrock of our vaccination strategy, that of vaccinating the most vulnerable. In some countries, we have seen vaccine doses reaching all levels of the population before a high percentage of vulnerable groups are fully immunized. PAHO urges countries to prioritize the elderly, frontline workers, and people with pre-existing conditions to protect them, but also to prevent the health system from becoming overburdened with severe cases. This recommendation by SAGE, an independent committee which advises WHO and PAHO, is based on the most robust evidence available. When vaccine availability is low, it is best to protect the most vulnerable first. Once those at greatest risk are protected, the next step is to immunize a high percentage of the adult population. Only afterwards should countries consider vaccinating younger groups. We have no evidence at this time that vaccinating students should be a prerequisite for reopening schools. This staged approach lays the best foundation for countries to reduce the circulation of the virus and eventually get their economies and societies back on track. The second is how to determine who needs an extra dose. Currently, we recommend providing an additional dose to only two groups. First, people who are immunocompromised, regardless of which vaccine they took. These include cancer patients, HIV-positive individuals, people taking some medicines like corticoids, and transplant recipients, and people over the age of 60 who received an inactivated virus vaccine, such as Sinovac or Sinopharm. These individuals need an additional dose to be protected from severe diseases and the risk of dying from COVID-19, and their vaccination cannot be considered complete until they have received their third shot. There is not enough evidence yet to recommend booster shots for other groups who are fully immunized, especially when vaccine availability is limited and many in our region still have not received their first shot. Our ability to quickly develop safe, effective vaccines against a new virus like COVID-19 has been a model of scientific innovation based on years of research, and our rollout of these vaccines is based on our vast public health experience in immunization programs. PAHO continues to work tirelessly to make these vaccines available to everyone in the Americas. But we are aware that most countries in the region still don't have enough doses to protect all adults, which makes it critical to follow expert guidance and maximize the impact of the doses that are available. Vaccination alone is not enough, but combined with effective public health measures, it is our best strategy for reducing COVID-19 transmission and saving lives. Thank you.
Muchas gracias, doctor Barbosa. Pasamos entonces a las preguntas que recibimos por correo electrónico y también en el chat. Recuerden, por favor, identificarse con su nombre y medio de comunicación. Empezamos con una pregunta from Barbados. Voy a hablar en inglés, de Marlon Madden from Barbados Today. This is a question for Dr. Ugarte. Given the current wave and Delta strain and the continued climbs of COVID cases and deaths in Barbados, in addition to hand washing, mask wearing, what other measures do you see as deterrent to the spread of the virus? And the easing of border, a second part to the question, how can countries find the balance between opening up for tourism and halting the spread of COVID? Dr. Ugarte?
Thank you for this question. It's a question that is recurrent in many occasions because we must recognize that all the variants of the virus that causes COVID-19 spreads from person to person mainly due to a close contact with an infected person, being that person symptomatic or not. So having that into perspective, every measure that will reduce the possibility of an infected person to transmit the virus to others are the measures that we need to maintain all the time, even when the populations are highly vaccinated in the communities. The main protection that has been, the evidence is widespread, is the use of masks. The use of masks will prevent the transmission from a person infected to others, but also will protect the persons who are in close contact with others that are using masks from being infected from another person. Of course, disinfection of hands is the other measure that also proved to be very useful, particularly when you're touching places where several other people may touch also and may get infected or may have virus that are active. And in addition to those, we have been also including other measures, including reduction of mass gathering, particularly in places where people come from several other locations, and also to have better ventilation in closed environments, for example, in restaurants, where many people will take off their masks because they will eat, of course. And in those places, it is very important to have better ventilation. And in those occasions when you are, if possible, you use your masks as long as possible. And also to reduce the distance in meetings, in schools, and in other places, in airports, in several other places, this physical distance is still a very good measure to reduce transmission. So meanwhile, we have this transmission in most of the countries, including Barbados, but many others, where in some locations we saw an increase of number of cases that may eventually overwhelm health services. These measures are the ones that are very useful. Regarding the easing the travel restrictions, it is important to highlight that the vaccinated persons, as Dr. Jarbas already mentioned, and we have been mentioning also several times, are better protected. Maybe will not completely eliminate the infection, but they are way more protected than the persons that are not vaccinated. And in that regards, allowing the persons who are vaccinated is a very good measure. But what the recommendation of WHO and also PAHO is not to restrict the travel of essential travels of persons who are not vaccinated, because the vaccines are not widely available, unfortunately, and it is a very important measure. And also recognize that when you reduce the restrictions for travelers, you recognize that you are accepting a certain level of risk. So in the communities that are accepting, or the countries that are accepting visitors, it is important to keep in mind the local transmission, and also to strengthen the surveillance capacity and to track what is the capacity of the health services and provide the visitors with clear, very easy to understand information so they can get health services as soon as they feel some symptoms or they think that they may have been in contact with a symptomatic person. So these are the measures that will reduce the transmission, and eventually will help also the tourism to be safe for tourists, but also for the communities that are receiving them. Thank you.
Muchas gracias, Dr. Ugarte. Thank you very much for your answer. Recibimos algunas preguntas, claro, sobre la vacunación en los niños. Vamos a agruparlas quizás. Recibimos pregunta de la web de la salud en Panamá. ¿Cómo avanza el proceso de vacunación pediátrica en la región de las Américas? Y también the PJD2 radio in St. Martin, referring to the CDC panel recommendation on the use of Pfizer for children between the ages of 5 and 11. What does that mean for the Caribbean countries still struggling to vaccinate their citizens? And how will PAHO help with the latest vaccine development? This question, Dr. Barbosa, perhaps for you.
Gracias por las preguntas. Hay muchas dudas y muchas cuestiones sobre eso. Primero, déjame de nuevo subrayar la recomendación que hacemos, que los grupos prioritarios para la vacunación son los grupos bajo un mayor riesgo. Las vacunas para la COVID-19 tienen dos objetivos. El primero es salvar vidas. Y todavía están a morir mucha gente en la región de las Américas porque no se ha alcanzado entre los adultos mayores, las personas con comorbilidades y otros grupos prioritarios la vacunación elevada que se necesita. Entonces, esa es la prioridad, sin ninguna duda, salvar vidas con las vacunas. El otro objetivo de la vacunación es disminuir la circulación del virus, controlar la transmisión, conjuntamente com as medidas de saúde pública. Então, por isso que o segundo grupo a se vacunar são todos os adultos, para que se pueda reduzir a transmissão do vírus. Sobre os niños, cada país está a tomar suas decisões. E é importante subrayar que é assim que funciona o processo de regulação. As decisões da FDA valem para os Estados Unidos, assim como as decisões da Agência de Saúde Pública de Canadá valem para Canadá, as de COFEPRIS para México, as de Anvisa para Brasil, as de SECMED para Cuba. Ou seja, todos os ministérios de saúde, trabalhando com suas autoridades de regulação, estão evaluando os dados, os estudos que fizeram os produtores de vacuna, que apresentam esses estudos e solicitam a autorização para uso em niños e niñas. Hasta o momento, a Organização Mundial de Saúde não ha terminado a revisão de nenhum pedido de produtor de vacuna para niños e niñas no mundo. Então, a recomendação que temos hasta o momento de las vacunas que têm o uso de emergência autorizado por la OMS é só a de Pfizer a partir de los 12 anos. Todas as outras, a recomendação é utilizar a partir de los 18 anos. Seguro que a situação é muito distinta em cada país, e há países que já têm muita vacuna, que têm mais acesso, que vão já empezar os niños como uma tentativa adicional de reduzir a transmissão. Mas quando miramos os dados de cada país, vemos que o problema, em verdade, não é a vacinação barra em los niños ou a não vacinação em los niños, é que não alcançamos, todavia, a vacinação de los grupos vulneráveis para terminar a mortalidade por COVID e vacinar a los adultos, todos os adultos, para reduzir a transmissão. Essa é a grande prioridade que todavia temos em las próximas semanas.
Muchas gracias, doctor Barbosa. Tenemos también un follow-up question del Associated Press sobre la cuestión de vacunar a los grupos que no son prioritarios o aún no han completado la vacunación de los, si tenemos datos de los cuáles países de las Américas han vacunado a los grupos que no son prioritarios y cuál han completado la vacunación de los más vulnerables. ¿Tienes alguna cosa a decirnos, doctor Barbosa?
Graças, Gisela. Mira, a OPS ha trabalhado bastante com os países da região para estabelecer planos em cada país, plano que deve ter etapas. E isso é muito importante, porque como a vacuna não está disponível para vacunar todas as pessoas ao mesmo tempo, em la grande maioria dos países, se país empieza a oferecer vacunas para todos e não concentra com estratégia de comunicação, com mobilização, aqueles grupos que são mais prioritários, podemos não estar utilizando as vacunas da melhor maneira. Por isso que é muito importante, e isso se pode confirmar quando se tomam os dados de cada país, por grupo de idade, por exemplo, há países que todavia não alcançaram uma cobertura elevada de 80%, 85% ou 90%, com as 2 doses das vacunas em las pessoas maiores de los 60 anos, que são um dos grupos prioritários. Então, hasta completar essa vacunação aí, começar a ofertar vacunas para adultos jovens, por exemplo, pode dispersar os esforços, perder a prioridade para essas pessoas que, em verdade, deveriam se vacunar primeiro. Então, o que estamos fazendo é trabalhar com os países para buscar identificar quais são as barreiras, porque as pessoas com comorbilidade, os adultos maiores, todavia não estão completamente vacunados. E desenvolver a estratégia para que se pueda, em cada país, alcançar essa prioridade, esse objetivo, que é o primeiro objetivo da vacuna, para, então, começar a ampliar a vacuna em los outros grupos que não são tão prioritários. Gracias.
Gracias, doctor Barbosa. Pasamos entonces para las fiestas y situaciones. Recibimos algunas preguntas sobre eso. Empezamos quizás con el Caribe. Kevin Felmin from The Guardian in Trinidad and Tobago saying, are risk transmission high in beaches or rivers, areas where there's a high concentration of tourism, or are they safe for public use? Similar, tenemos también una pregunta de México, de Uno TV, de Belina Ochoa, sobre los días de los muertos que se celebró la semana pasada, con muchos tumultos, sin distanciamiento, si esto ocasionaría nuevos contagios. Paso la pregunta al doctor Aldiguiere, por favor. Las 2 preguntas.
Yes, thank you for these 2 quite different questions. I will start with a question from Trinidad and Tobago, from the Caribbean. And thanks a lot for this question that will help me to once again stress the importance of the public health measures, including in the context of the progress of vaccination campaigns in the Americas. Dr. Ugarte has already commented regarding the importance of the use of masks at the beginning of this press conference. The first aspect, the important aspect for the public, is to carefully check the guidance from the local health authorities. Public health authorities, national or subnational authorities, have established now for more than 20 months a battery of public health measures that clearly describe what to do and what not to do. So please check the guidance from your health authority. The second aspect is that we know that according to the transmission patterns of a virus, the social distancing and avoiding the closed environments are, together with mask wearing, the most important tools for limiting the transmission. Therefore, the citizens, the public, have to really incorporate these basic measures in their lifestyle, including in beach and seaside and vacation activities. Ahora la pregunta sobre México y que tiene varios enfoques. Primero, quisiera subrayar que tenemos que ser muy prudentes en aspectos de predicciones. Los modelos existentes no permiten hacer predicciones a muy largo plazo. Nuestra experiencia regional de los últimos 22 meses de pandemia, además de un análisis diario y semanal de los informes que comparten los países de la región, nos permiten hacer consideraciones siguientes. En México, la baja continua de casos es una excelente noticia para toda la comunidad, desde el punto de vista sanitario, punto de vista social, económico y también de bienestar mental. Lo que permitió la realización de eventos familiares y sociales durante los días festivos alrededor del Día de los Muertos. Sin embargo, a pesar de las advertencias, podemos decir que no se cumplieron suficiente las medidas preventivas por la comunidad, por la gente, con sana distancia, higiene de mano y sobre todo uso de mascarillas, lo que destaqué en la pregunta anterior en inglés, que venía del Caribe. Existe un riesgo de emergencia de casos también durante el invierno, y los festivos del fin de año son propicios a una posible aceleración de la transmisión de persona a persona. Todos los mecanismos de alerta y respuesta deben mantenerse activados. Espero haber respondido a las inquietudes de la periodista de México. Gracias.
Muchas gracias, doctor Alighieri. Tenemos dos preguntas de búsqueda Uruguay sobre la apertura de fronteras y también del periodista Tobias Käufer, Die Welt de Alemania. Quizás voy con esa porque en general, Dr. Ugarte, from a medical point of view, how do you assess Costa Rica's decision to allow vaccinated tourists only into the country? Perhaps a general explanation. Por favor.
Thank you. This is also another very important question, but it needs a clarification. Costa Rica actually does not require a proof of vaccination as the only condition to enter the country. Neither Costa Rica requires a coronavirus detection test or it issue also sanitary confinement orders to enter the country by air or by land. So there are no strict provisions in that regards. But from August 1st of this year, all tourists who are fully vaccinated against COVID-19 that have received the Moderna, Pfizer, AstraZeneca, Johnson & Johnson can enter the country without a travel policy. So that's a provision that will benefit the persons who have been vaccinated. And the last dose of the vaccine must have been applied at least 14 days before arrival in Costa Rica. So travelers who are vaccinated are exempted from purchasing a travel policy that covers COVID-19 care and quarantine if necessary. So it is also an additional benefit for the persons who are vaccinated. Those who are not vaccinated may have to buy a travel policy or insurance to cover the health costs if they get sick from COVID-19 or other diseases. So I would like to emphasize that basically Costa Rica is operating under the WHO and PAHO guidance and recommendations, and also the recommendation of the current temporary recommendations of based on the international health regulations. And those perspectives are also in line with a medical perspective. So in general, when we are looking at the countries that are requiring vaccination for visitors, it is a way to easy or facilitate the entry into the countries. At the same time, there are other additional provisions that are taking place with persons who are not vaccinated and are in general provisions that will reduce the transmission for the visitors, but also for the communities that are receiving them. Again, we need to ensure that all the conditions, the transmission and the country of origin and the country of destination are closely monitored, so we can even further reduce the transmission in both sides. Thank you.
Thank you very much, Dr. Ugarte. Tenemos pues una pregunta ahora también sobre las otras enfermedades que empiezan en invierno del hemisferio norte, el verano del hemisferio sur. Es una pregunta del Comercio Perú. Gerson pregunta, ¿está iniciando la temporada de mayor circulación de dengue en Perú y otros países? ¿Qué medidas recomienda la OPS para atender esta enfermedad y a la vez estar preparado para una posible tercera ola de COVID-19? Doctor Alighieri.
Sí, gracias por esa pregunta que viene de Perú, pero quiero que es lógico de responder con un enfoque regional, porque tenemos todos los países de la zona intertropical de las Américas en la misma situación. El dengue es endémico en las Américas, en su zona intertropical, y su vector Aedes aegypti está presente en muchos países y territorios. En el contexto de la coexistencia de la COVID-19 con el dengue en muchos países y territorios de la región, recomendamos a los ministerios de salud y a los países en general a que continúen con el fortalecimiento de la vigilancia, el establecimiento de un triaje de los pacientes y acceso a diagnóstico y tratamiento oportuno y adecuado del dengue. En este complejo contexto de la pandemia COVID-19 que ha impactado mucho en los servicios y sistemas de salud. Al mismo tiempo, es importante establecer estrategias para facilitar el acceso a los servicios de salud de los pacientes con dengue y además de fortalecer la comunicación de riesgo para que los pacientes con signos de alarma acudan al centro de salud o al hospital de manera oportuna, pero destacamos la importancia de la red de atención primaria, los centros de salud más cerca de la población. La OPS recomienda el triaje adecuado de pacientes, tanto para la detección oportuna de signos de alarma de dengue, potenciales complicaciones de pacientes infectados por el SARS-CoV-2 agente de la COVID-19 y también para disminuir el riesgo de infecciones por el virus SARS-CoV-2 que podrían ser adquiridas en los servicios de atención en salud. En este contexto, la OPS publica de manera regular actualizaciones epidemiológicas sobre el dengue y otras arbovirosis y también ha publicado guías técnicas para el manejo del paciente sospechoso de la COVID-19 en diferentes niveles de atención en salud, incluyendo, y yo quisiera destacar otra vez la noción de triaje, los aspectos que permiten un mejor control de infecciones en los servicios de salud. Espero haber respondido a la pregunta de Perú que yo me he permitido ampliar a toda la zona intertropical de las Américas. Gracias.
Muchas gracias, doctor Alighieri, por aclarar la situación. Pasamos entonces, recibimos preguntas sobre la entrega de dosis de vacunas a los países. Tenemos preguntas del Comercio Perú. sobre la cantidad de vacunas que llegaron a Perú a través de COVAX y también de Venezuela, también similar, para cuándo se espera más dosis de COVAX. Doctor Barbosa, quizás tiene una actualización.
Gracias por las preguntas. Seguro que en muchos países hay muchas inquietaciones y dudas sobre si van a tener las vacunas para poder vacunar a todas las personas, los más vulnerables, vacunar a todas las personas que pueden se vacunar y con esto, conjuntamente con las medidas de salud pública, alcanzar el control de la transmisión. Mira, Perú, de maneira específica, já ha recebido ao redor de 2.870.000 doses de vacuna. Tem mais 1,5 milhão de vacunas de Sinopharm, que se está empezando a entrega. As primeiras 236.000 doses já se entregaram no dia 30 de outubro. E temos os outros 1.150.000 doses que se está em negociação com o produtor e com o país para informar a fecha, o vuelo, o horário que chega. E además, Peru também está com 3.800.000 doses de Pfizer em processo de negociação entre o produtor e o país para que se pueda concluir e enviá-lo o mais pronto possível antes do final de ano. Em caso de Venezuela, ingressou em COVAX depois, por os problemas que já mencionamos em outras conferências de prensa, pero as vacunas estão chegando, afortunadamente, já para a Venezuela. A Venezuela ha recebido ao redor de 2.594.000 doses de la vacuna Sinopharm. Já está para receber, no mês de novembro, hasta a terceira semana, provavelmente, outros 2.500.000 doses de vacuna, e também se está em negociação de mais 6,2 milhões de doses de vacuna de Sinopharm também para Venezuela. Como se passa esse processo? Quando o secretariado de COVAX hace a alocação, a asignação de las vacunas, então, quando recebemos a lista de los países de cada ronda de asignação, entramos imediatamente em contato com o produtor e com o país, para ver se todos os aspectos legais, regulatórios, administrativos, se os pagos, se todo está listo, para que se pueda informar ao país qual vai ser a fecha exata, a quantidade de doses, o vuelo que vai chegar. Então, esse processo estamos trabalhando de maneira muito rápida. Na região de las Américas, com os 42 anos de experiência do fundo rotatório, e como para nossa região é o fundo rotatório quem hace todos os arreglos em nome do mecanismo COVAX, é uma da região que alcançamos um menor tempo entre a informação de que a vacuna está já assignada e a chegada a los países. Então, seguimos trabalhando com isso para que os países possam receber de COVAX todas as vacunas que estão comprometidas. A grande maioria dos países solicitaram ao redor de 20% de sua população. Esse é um promédio, há variações em cada país. O secretariado de COVAX ha informado que, por todos os problemas que COVAX ha enfrentado durante esse ano, só vai completar as entregas no primeiro trimestre do próximo ano. Por isso, estamos também com outras alternativas para os países, falando com os donantes para que mais donações possam chegar à região. Como falamos ao princípio, mais de 19 milhões de doses foram donadas para países da América Latina e do Caribe, o que foi essencial para ampliar o acesso. E estamos também com a possibilidade de compra direta por el fundo rotatório. Alguns países já enviaram seus pedidos e já estamos no processo de negociação com os produtores para empezar as entregas. Gracias.
Muchas gracias, doctor Barbosa. Tenemos también una pregunta sobre las vacunas from Alfia Sumner of the Jamaica Observer. Does PAHO have any concerns, advice, or a word of caution to countries such as Jamaica that have had large volumes of doses expire in recent days, despite low vaccination rates? Should these countries be concerned that donors may become hesitant to donate the vaccines? Dr. Barbosa.
for this question. I think that it's very important to increase the access to the vaccines. I think that this is the main problem that we have in Latin America and the Caribbean. But in some countries, and Jamaica is one of these countries, unfortunately, we have seen some vaccine hesitancy among the population. So we are working with the Ministry of Health of Jamaica and other countries to develop and implement a communication strategy to reach out the population, to provide transparent information, to share with the health professionals the most recent scientific evidence that we have, to show what is the process to have a vaccine approved, all the tests and clinical trials that a producer has to make to ensure that the vaccine is safety and efficacious. So we are working with the countries because we need to use the vaccines. We need to protect the people, and we need to reduce the transmission. In very exceptional situations, like in Haiti, that had a very important political crisis, and they also had some problems in the country, we moved the vaccines, 250 doses from Haiti to Honduras, exactly to prevent any loss of vaccine doses in the region. So we are monitoring this. We are working with the Ministry of Health to ensure that they can use the vaccines that are available. I think that this is the most objective that you have now. Thank you.
Thank you very much, Dr. Barbosa. Pasamos a la próxima pregunta de un periodista de Bolivia, Verifica, sobre los síntomas de que las personas enfermas de COVID pueden tener, que se llama dedos COVID, the COVID toes, me imagino en inglés. ¿Qué se sabe al respecto? Doctor Aldiguiere.
Sí, gracias por esa pregunta de Bolivia. Después de 22 meses de evolución de la pandemia en nuestra región, la verdad es que se ha mejorado bastante el conocimiento clínico de la COVID-19, que ha sido frecuentemente asociada a manifestaciones de la piel en adultos como en niños. Los signos más reportados en los informes de la comunidad médica, signos de la piel, son el rash, la erupción vesicular, urticaria y lesiones con decoloración de los dedos, manos y pies. Efectivamente, esas lesiones se reportan mucho como dedos de COVID, COVID fingers en inglés. Y de acuerdo con estudios que tenemos que reconocerlo, varios sesgos, alrededor del 10 a 20% de los pacientes con COVID tienen manifestaciones dermatológicas. Entre esos, una proporción pequeña presenta este tipo de dedos COVID, COVID fingers. Y se ha visto que esas lesiones pueden aparecer en casos que tienen mayor severidad y o factores de riesgo como la obesidad, la hipertensión arterial y la diabetes. Sin embargo, como dije, hace falta mayor investigación. No hay tratamiento específico, además del tratamiento general de disminuir la respuesta inflamatoria en esos casos más graves. Esa manifestación dermatológica, los dedos COVID, tiende a desaparecer en la medida que mejora la respuesta inflamatoria, al igual que la enfermedad. Espero haber respondido a la pregunta del colega periodista de Bolivia. Gracias.
Muchas gracias, doctor Aldiguiere. Una pregunta de Paola Martínez, de Transparencia Venezuela, una pregunta de seguimiento al doctor Barbosa. ¿se puede decirnos cuál es la marca de la vacuna que se enviará a Venezuela en la tercera semana de noviembre? Doctor Barbosa, ¿tenemos información detalladas?
Sí, gracias. Para cada país se ofrecem as vacunas que estão disponíveis em cada ronda de asignação e muitos países da região, não somente Venezuela, podem ser suas escolhas. Países que creem que é melhor utilizar uma vacuna que outra porque seus profissionais já estão treinados para aquela vacuna. Então, essas vacunas que vão chegar para a Venezuela são vacunas de Sinopharm, que é uma das vacunas que está autorizada para uso de emergência por lá Organización Mundial de la Salud. Gracias.
Muchas gracias, Dr. Barbosa. We have a general question on a recent CDC study that came out saying that if you've been infected with COVID, would not give you enough protection, so you would need a vaccine. Asking for a comment. Is that true? Does having been infected with COVID give you enough protection, so you don't need a vaccine, or the opposite? Maybe Dr. Barbosa, you can clarify this and comment.
Thank you for this question. This was a very important study that was released this week, at the beginning of this week, and it clearly shows that it's not true. Some fake news that unfortunately in some countries are released saying that if you got the COVID-19, you don't need to get a shot. This is not true. In many countries now, we have good data showing that you can have a second time COVID-19, you can have a new disease because the protection that is provided by the natural infection is limited, and also because you can have a new COVID-19 due to other new variants. So it was well known. This study clearly shows that it's much better to get the protection from the vaccine. This study compared two groups. One group had the disease and no vaccine, and the other group had the vaccine, the vaccines that are used in the US, the mRNA vaccines. After 6 months, when they compared the two groups, the group that received the vaccine was 500 more protected than the group that only had the disease. So this is a very important information, and for this reason, it's crucial that in every country, the ministries of health develop a communication strategy to cope with this fake news around the vaccine, misinformation that people sometimes are spreading, that even people that had the disease, they still needed to be fully vaccinated against COVID-19. This is the best way to protect them. Thank you.
Gracias, perdón. Doctor Barbosa, muchas gracias. Tenemos más una pregunta sobre las vacunas a Nicaragua. Nina López, de la prensa, la OPS donó más de 100,000 dosis a finales de septiembre, pero hasta ahora no se han aplicado. Con eso en el organismo conocemos nosotros los motivos por los cuales el ministerio no ha aplicado la vacuna. ¿Qué recomendaciones daría el ministerio sobre la actual jornada de vacunación de 2 a 29 años? Sobre Nicaragua. Quizás, doctor Ugarte, ¿puede contestar a esa pregunta?
Sí, Luciana, muchas gracias. Bueno, tenemos información que el Ministerio de Salud de Nicaragua ha definido, tiene organizado más de 1.800 unidades de salud para el despliegue de las vacunas de COVID-19 a nivel de todo el país, a nivel nacional, y que se están priorizando la aplicación de las vacunas que han estado disponibles anteriormente, de acuerdo a las edades y los factores de riesgo, como el de mujeres embarazadas y puérperas, así como la fecha de vencimiento de la vacuna. De tal manera que la aplicación de las vacunas que llegaron de Honduras están en camino, están siendo programadas para ser aplicadas. Y quisiera resaltar este último punto, la donación de vacunas provenientes de Honduras a Nicaragua. Esto es una muestra de solidaridad que es cada vez más frecuente, tanto entre países de la región como de países de otras regiones, para los países que tienen muy baja cobertura de vacunación, y se requieren aún más vacunas para llegar al menos a proteger a la población de mayor riesgo. En ese sentido, nuestra recomendación es que la población continúe vacunándose y que los países usen la mayor cantidad de vacunas lo más pronto posible, de tal manera que esa protección se logre en el menor lapso posible. En el caso de Centroamérica hablamos de países que requieren mayor apoyo. Hemos hablado de Honduras, también por supuesto Nicaragua, Guatemala y otros países. Y en el caso del Caribe necesitamos también vacunas adicionales para llegar a niveles de cobertura. Es importante que la población que no está vacunada se vacune. Ya lo ha mencionado varias veces durante esta conferencia de prensa y antes. Vacunarse es una de las mejores medidas de protección para evitar fallecer o tener un episodio grave de la COVID-19. Y continuar con las medidas de protección en todo momento, mientras todavía continuemos con la COVID-19. Gracias.
Muchas gracias, doctor Ugarte, por la respuesta. Estamos llegando al final de la sesión, tenemos unos 5 minutitos. Creo que tenemos una pregunta general sobre the decreasing trend in cases and deaths that were mentioned in Dr. Barbosa's opening remarks. The question is, are we getting close to the end of the pandemic? Dr. Barbosa, perhaps we can wrap up with this answer. Thank you very much.
Thank you, Luciana, and thank you for this question. I think that first it's important to recognize the efforts that the Ministry of Health in the region of the Americas have made to cope with the pandemic. This was the biggest challenge that we have faced in more than 1 century. And in a region like Latin America and the Caribbean, with inequalities, with poverty and extreme poverty, with many people that live in a almost natural crowded situation in Islam, it was not easy to make the public health measures effective during many months in the region. At the same time, Latin America and the Caribbean, despite the fact that this region was the epicenter of the pandemic, we also had many problems to access the vaccines that the countries needed to protect their population. Despite all of this, working together in a close collaboration with member states, we can see now that we have a clear trend, a sustainable trend in most countries, that the COVID-19 number of cases and deaths are declining. However, this is not the end of the pandemic, for sure. We need to remain vigilant. We need to keep all the surveillance systems working in order to identify in a very early stage if we have another increase in the number of cases. We needed to keep all the public health measures. Wearing masks, for instance, can reduce around 20% of the transmission alone. Combined with physical distancing, avoiding crowded spaces, it can be a very important pillar to control the transmission. And finally, we also needed to get more vaccines to achieve a very high coverage in every country in the region. We have a very different situation. Some countries in our region have now more than 70% of their population fully vaccinated, but the average in many countries around 40 or 45% of the population. And as I mentioned before, we still have 5 countries that they have not yet vaccinated 20% of the population. Let's learn with other countries. This week, Germany and the Netherlands announced the new measures to reduce the transmission after weeks and months of sustainable decrease and a very low community transmission. So the pandemic is still among us, and it will remain for weeks and months, and we cannot have the false security impression that the COVID-19 pandemic is over. It's not, and we need to keep the good work in the Ministry of Health. We need to work closely with this ministry, providing technical cooperation to ensure that in every country in our region, the transmission will be controlled. Thank you.
Gracias, doctor Barbosa. Un mensaje muy importante. Llegamos entonces al final de nuestra sesión de hoy. Recuerden que pueden encontrar más informaciones en nuestro sitio web, en la página www.paho.org. Y también la grabación de esta sesión estará disponible en nuestros canales. Claro, pueden también nos enviar preguntas al equipo de prensa, al correo mediateam@paho.org. Muchísimas gracias por conectarse hoy y nos vemos entonces la próxima semana. Muchas gracias por la participación.